The paradigm for years was surgery. Then with the introduction of medications, surgery kind of fell off for treatment of this disease. Now, as time has gone on, we're starting to see a little bit more out in the community and the news about the concerns about long-term use of these medications. And I see that in a lot of patients that come in that ask about it. I think it's a valid concern, and it is something still that's being investigated. But there are some things and some studies out there that show that long-term use of like Prilosec and Nexium can be hazardous to their health. The next option is now starting to look to surgical options, and there are a variety of things that have come about since the late 1950s. Back then we started with a very traditional approach in terms of controlling reflux, using people's native anatomy. Now we've kind of graduated over the years using what's called a Lynx device. It's something I started doing here about 2 years ago. It's been around now since about 2012 when it was approved by the FDA. It's an implantable device that helps to control reflux. There are other things that are done endoscopically now. One that's called the TIF. It's called transoral incisionless fundoplication, so that's what the TIF stands for. And it gives us an opportunity to kind of create a new valve on the inside of the esophagus to help with reflux. And then the last thing that's out there that people have done is what's called stretta. And that's, again, an endoscopic procedure that allows you to ablate the tissue at the lower part of the esophagus, and basically it causes it to get burned, which in turn leads to hypertrophy. And the thought is that helps to bulk up the muscle there to help prevent reflux. Those are probably the most common things used now. In terms of if you were to sequence them in order from 1 to 4, that's probably where they would land. As time has gone on, I think Lynx is slowly growing favor with treatment of reflux in comparison to fundoplications. When folks come back and tell me, you know, this past week since surgery is the first time I've slept all night, or it's the first time I've had orange juice or coffee in years because I couldn't do it beforehand. Unfortunately, so many of the things that we like to eat cause people to have symptoms, and there's a long list of those things. So when I have someone come in and say, hey, you know, this has been life-changing for me, it just sort of solidifies, you know, why I do this, why I enjoy doing it, and then basically why I continue to do it.